With the WINN FM News, I am Kevin Brown.
And I am Yulana Weeks.
Our top stories.
Water engineer anticipates desalination plants will be online in 2025. Recent road tragedies reignite road safety campaign.
Avian influenza H5N1 and its implications for the region. The Royal St. Christopher and Nevis Police Force provide more details on tragic traffic accident that claimed 4 lives in St. Kitts. Police investigating sudden death of 51-year-old St. Johnson's Village resident. HIV and AIDS Secretariat Director reports 237 known cases of HIV in St. Kitts and Nevis, suggests the actual number is higher. Guyana opposition party says 10% salary increase for public servants further widens income gap. St. Lucia's Dr. Ernest Hilaire prepares for legal battle against opposition member Nancy Charles. Internationally, Israeli strikes kill 12 guarding Gaza aid lorries, medics say. Now, the details.
Mr. Cromwell Williams, manager and engineer at the Water Services Department, projects that the Bastia desalination plant will be completed by summer 2025. The plant, located at the CA Paul Southwell Industrial Site, is in its early stages of construction. Upon completion, it will allow for 24-hour water restoration efforts in Bastia.
So we finally started the Bastia desalination plant, 2 million gallons per day. That has actually had ground earth movements and so on. We've started the actual construction of the site, and so that is expected to be substantially completed around July or August of next year. So once that plant is completed, the residents of Bastia and the surrounding areas should move. We should be able to restore 24-hour supply. So that's basically where we are in terms of meeting our shortfall in terms of production capacity at the moment.
The desalination plant at Canada Estate is completed and undergoing testing. However, there are concerns about erosion in its vicinity, which requires some work.
Good. So that plant is substantially completed and we're in the testing phase. Some minor bugs that are being sorted out, still to be sorted out, and so we expect that definitely maybe in the first quarter that plant will be commissioned.
Mr. Williams anticipates the commissioning of the Canada Estate desalination plant in February 2025. Following the December 11, 2024 tragedy in St. Kitts, there has been an intensifying outpouring of pleas for motorists to drive with due care and attention. The accident gave rise to concerns about speeding and a lapse in concentration or judgment. Quote, "We continue to make a plea for our motorists to drive responsibly and respectfully in the interest of the public good. We can do this for ourselves and others," said the Permanent Secretary in the Ministry of Health, Curtis Martin. Mr. Samal Duggins, Minister of Agriculture, Sports, Creative Economy et al., shared the importance of exercising patience and obeying traffic laws. Quote, "I urge all drivers to slow down, stay focused, make responsible decisions. Drive not only for yourself, but for those around you. Avoid distractions. Above all, do not drink and drive. As our own Byron Messiah wisely said, it no makes sense speed race if you can't reach home safe." Let us hold on to these words and make safety our top priority. Every journey should end with you returning home to your family and loved ones. I call on all citizens to practice patience and courtesy on the roads. This is not just about avoiding accidents. It's about protecting the spirit of the season by valuing what truly matters, the lives of our people." Unquote. The December 11 crash tilted the road fatality table from 7 to 12. Just 5 days prior, on December 6, 2 young persons lost their lives in a car crash on the F.D. Williams Highway. The fresh memory of the incident made clear the serious concerns about road safety. The fatality count for 2024 also surpassed the 2023 toll, which was 7. The nation's Prime Minister, Honorable Dr. Terence Drew, also moved by the recent road tragedies, appealed to motorists to refrain from driving if smoking and drinking alcohol. Quote, "I want to take this opportunity as we enter into the festive season to appeal to you, our people, our motorists, that while you enjoy yourself, and you should, to make sure that you drive with due care and attention. I am appealing to all of you to not drink any alcohol and drive. Do not smoke any substances and drive, unquote. Deputy Prime Minister Geoffrey Hanley also lent his voice to the calls for careful driving. He said, quote, I also implore drivers to exercise greater caution and courtesy on the road. We only hurt ourselves and others when we are in great haste to get from one point to the next, unquote. Senior Minister and Minister of Foreign Affairs Dr. Denzel Douglas noted, quote, let this tragedy serve as a solemn reminder. Our roads demand caution, respect, and responsibility. They are not going anywhere, but the lives we lose on them cannot return, unquote. According to the Royal St. Christopher and Nevis Police Force, there hasn't been any other traffic accident that resulted in 4 deaths in approximately the last 30 years. On social media, a local orator and poet, Kervin Milobox Freeman, shared his opinion that the incident is the deadliest day in St. Kitts since the sinking of the MV Christina in 1970, adding that our country was really dealt a sad, sad blow.
The recent press conference conducted by the Pan American Health Organization on December 10th has highlighted the growing concerns surrounding avian influenza H5N1 and its potential spread in the region, including St. Kitts and Nevis. Dr. Andrea Vicari, head of the Infectious Threats Unit at PAHO, discussed the rising incidences of H5N1 among poultry and its ramifications for human health. In 2024, the Americas have witnessed a significant uptick in human infections, with 58 cases reported in the United States and 1 in Canada. This considerable rise has raised alarms about the virus's potential implications for public health and agriculture. Concerns over transmission risks has intensified as instances of H5N1 have been documented in dairy cows. This highlights an unexpected vulnerability in this sector and raises concerns about the viability of dairy production and export.
We've seen how avian influenza has spread in the Americas the last few years, so this virus H5N1 has spread, as we have seen with migratory birds throughout the whole continent. And this has caused also infections also in these birds or poultry, right, in the farms and in other producers. So besides this spread throughout the whole continent, we have seen also what is a spillover spread in other species as well, especially in mammals. Up to 50 species have been reported of mammals that have been affected as well by this spread. So, and of course, we see what is happening also in our dairy cows in the US. We see this manifestation of what is going on, which basically is happening throughout the whole continent. We have seen also marine mammals in Peru, Chile, Argentina that have also been affected in great numbers. So the specificity perhaps of this transmission in dairy cows is essentially that these dairy cows had not been acknowledged before as a species that's susceptible to influenza virus A. So they were susceptible to D specifically, but not influenza A. So this is basically one of these species of mammals, as we said before, that are being affected. And obviously we have seen that this transmission happens through direct contact within the cattle, and also due to workers in the sector also, which may be an instrument due to this environment that we see in these production farms.
In her statement, Dr. Vicari underscored the importance of safeguarding farm workers, those at higher risk of exposure to infected animals, by ensuring proper protective measures are in place. PAHO has reiterated the necessity of heightened surveillance and genomic characterization to monitor the virus's evolution and potential adaptation to humans. The organization has called for intersectional collaboration among the health, veterinary, and environmental sectors to ensure early detection and a coordinated response during an outbreak. Given the tourism-driven economy of St. Kitts and Nevis, the spread of avian influenza presents a pressing challenge. The potential for economic disruption linked to disease outbreaks must not be underestimated, especially in a region heavily reliant on the travel industry. In addition to an outbreak's economic effect on the tourism industry, there can also be a disruption of the country's residential population, negatively affecting the economy.
In our region, 3 of every 10 people face obstacles that make it difficult for them to access health services. These obstacles, they include high costs. We also have the lack of health insurance, difficulty in reaching these health centers, waiting for a long time, and also we see poor experiences when they're looking for healthcare. One of the major problems is out-of-pocket expenses. So what the families need to pay directly for these medical services, medication and treatment. So this is still a huge economic load for so many people and families, and in extreme cases can lead to poverty.
As countries in the region face dual threats from arboviral diseases like dengue and H5N1, the health policy recommendations emphasize preventative measures, including vaccination for at-risk populations, training for healthcare workers, and tactical public awareness campaigns. The call to action is stark. Strengthening health systems is paramount to mitigating these health threats and ensuring the population's safety in St. Kitts and Nevis and throughout the Caribbean. PAHO continues to advocate for investment in health systems while recognizing that equitable access to healthcare is essential for all populations. Vigilance, preparedness, and community engagement remain the keys to successfully navigating the dangers posed by emerging infectious diseases in the region. A devastating traffic accident in St. Kitts has left 4 individuals dead, prompting a thorough investigation by the Royal St. Christopher and Nevis Police Force. The collision occurred on the main road near Brimstone Hill between 7:15 a.m. and 7:45 a.m. on December 11, 2024. Initial reports indicate that an omnibus carrying 5 passengers collided with a Jeep that had 1 occupant, leading to a catastrophic series of events. Emergency services were dispatched promptly to the scene where 2 individuals, Rosina Herbert of Sandy Point, a passenger in the omnibus, and Dijon Davis of Old Road, the driver of the Jeep, received urgent medical attention. Sadly, Ms. Herbert passed away shortly after arriving at the Joseph and France General Hospital. Mr. Davis underwent emergency surgery for severe injuries but also succumbed to his condition. 2 other victims, Ian Jules of St. Paul's, who was a passenger in the Jeep, and Belinda Paul of Sandy Point, a passenger in the omnibus, were pronounced dead at the scene. Reports indicate that another passenger from the omnibus has been admitted to the intensive care unit, while another is recovering from minor injuries in the surgical ward. The driver of the omnibus, Jamie Herbert, and 1 more passenger received treatment for minor injuries and have since been discharged. The Royal St. Christopher and Nevis Police Force is investigating the sudden death of 51-year-old Cleon Bugnan Ray from St. Johnson's Village following the discovery of his body on December 11, 2024 in Bird Rock. The circumstances surrounding his death remain unclear, prompting authorities to conduct investigations into the matter. Ray was reported missing before the discovery of his body. Police officers initiated searches in various locations known to be frequented by him. Their efforts led to the finding of Mr. Ray's parked passenger bus on Curry Hill located near Bird Rock. Officers located him lying motionless in the foliage nearby, and he was pronounced dead at the scene upon examination. An autopsy is scheduled to determine the precise cause of Ray's unexpected death. As the investigation unfolds, more information will be provided. In a recent interview on WINN's Island Tea on December 11, 2024, Dr. Matthias Ufre, director of the St. Kitts HIV/AIDS Secretariat, emphasized the ongoing challenges and strategies in the fight against HIV and AIDS in the Federation. The discussion highlighted the current state of HIV awareness, prevention strategies, and the urgency of addressing misconceptions about the disease. On the heels of World AIDS Day, commemorated globally every year on December 1st, Dr. Ufre, in conversation with WINN, said,
The 1st of December is always acknowledged as World AIDS Day. And for this year, the theme for this year is Take the Rights Path. In other words, everybody has a right and everybody should be acknowledged. So without discrimination, without stigma, Everybody should be acknowledged. Everybody have the right to access health care. Everybody have the right to be tested. Everybody have the right to access medication. Everybody have the right to be themselves based on their decision that has to be do with their sexuality. So taking the right path is taking the right path to stand to eliminate stigma and discrimination and ensuring health care for all.
Dr. Ufre revealed that there are approximately 237 known cases of HIV in St. Kitts and Nevis, but cautioned that this number likely underrepresents the actual situation. He suggested that the number may be higher because of a lack of testing.
You can multiply that times 4. Why? Because most persons have not been tested, and as such, we cannot completely give you a fixed figure.
The Ministry of Health is working to enhance testing availability across health centers and hospitals, emphasizing that HIV is still out there. The director elaborated on the difference between HIV and AIDS, explaining that HIV is the virus responsible for damaging the immune system, leading to AIDS, which represents the syndrome resulting from advanced HIV infection. Dr. Ufre pointed out that preventing exposure to HIV is crucial, especially during the festive season when risky behaviors may increase.
This festive period, people make some rash decisions. And of course, sometimes because of the high consumption of alcohol, some persons actually make decisions they will not make if they're in the right senses. That's why we're saying that get tested, know your status, and condomize. The ABC of prevention is abstinence. Abstinence is very much still an option.
He warned, advocating for awareness and education about safe practices. To combat HIV, the Secretariat actively engages in various outreach initiatives, including condom distribution drives and school educational programs. Dr. Ufre highlighted the importance of shared responsibility in testing, encouraging both partners to get tested rather than assuming safety based on one partner's status.
And the other thing that I want to make the public know is that, yes, your partner might be going to test. And you say, if my partner is good, I am good. That is definitely false, because we have had couples where one is positive and the other is negative.
During the interview, Dr. Ufre also addressed concerns regarding the perceived decline in the urgency of AIDS awareness. He noted that the fear factor associated with AIDS has diminished significantly due to advancements in treatment influencing public perception.
Because of the treatment availability, and people feel like, yes, I can't die from AIDS anymore.
He stated, suggesting that greater awareness and education efforts are needed. He acknowledged that while efforts to inform the public are ongoing, increased public service announcements and outreach are needed. Dr. Ufre confirmed that 86% of patients adhere to their treatment regimen, essential for effectively managing the virus. He encouraged individuals to be proactive about their health and to maintain open conversations about sexual health with partners.
People don't have conversations these days anymore. You just want to go in. I know you today. I get intimate with you today.
He lamented, underscoring the importance of communication in reducing the risks of STI transmission. The director highlighted the Secretariat's commitment to providing free access to treatment and testing, a significant advantage in St. Kitts and Nevis compared to global trends where such services often require payment.
In fact, most countries you have to pay for the treatment, but in St. Kitts and Nevis, the Ministry of Health and the government have ensured that testing and treatment is free and is available.
Looking forward, Dr. Ufre expressed hope for an expanded presence of health services at local events to heighten awareness and accessibility. Plans for distributing condoms at large gatherings such as carnival festivities were also discussed. He concluded with a poignant reminder to the public during this celebratory season.
Please, Santa will be going around giving shiny gifts. Just make sure that the gift you're receiving is not STI or HIV. So be smart.
Dr. Ufre's call to action highlights the ongoing need for vigilance, education, and community engagement in the fight against HIV and AIDS in St. Kitts and Nevis, particularly as stigma and misinformation continue to pose significant challenges. In regional news, Guyana Opposition Party says 10% salary increase for public servants further widens income gap. Guyana News source reports.
The opposition People's National Congress reform has hammered the across-the-board 10% salary increase for public servants, as giving more to the wealthy while giving less to the poor. The party stated that those at the top end of the scale will be seeing a far bigger retroactive paycheck than those at the bottom, further widening the pay gap. The party also said the PPP government needs to end the practice of giving large increases to themselves while giving a pittance to workers.
The president, whose salary is $2.9 million tax-free, will receive a monthly salary increase of $290,000, which translates into a retroactive pay of $3,480,000. Add this to his monthly salary, he will receive in December a pay package of $6,380,000. What this means is that the president in 1 month retroactive monies will get more than 2 times the money the public servants will get for the entire year.
According to the party, ministers of the government with a basic salary currently at just over $1 million will get about $107,000 a month retroactive to the 1st of January, which is an astounding $1.284 million. The party said PPP ministers and super salaried family, friends, and favorites will therefore receive a paycheck for December of more than $2.3 million. On the other hand, a level 1 public servant will receive a tiny increase of around $10,000 per month, or $120,000 retroactive to the 1st of January.
On the other hand, a level 1 public servant will receive a tiny increase of $10,000 per month, or $120,000 retroactive to January 1st, 2024. What this means is that the PPP elite, their friends, families, and favorites will be paid in 1 month nearly as much as what a typical worker will be paid for the entire year.
The party reminded that when it was in government as part of the APNU-AFC coalition, larger increases were given to those at the lower levels of income. The opposition party also said low-level public servants should have been given a significant increase, and it is promising a 35% graduated salary increase for public servants if it is returned to office. According to the People's National Congress reform, it is important also to note that the increase must be seen in the context of persistent inflation in Guyana, with prices rising at greater than 3% this year, if the government's own statistics are to be believed. Former finance minister under the APNU-AFC government, Winston Jordan, today stated that the government needs to seriously address where it wants salaries to be and how to get there in terms of the kinds of increases that will allow salaries to remain competitive. The Guyana Public Service Union, which signed a 2-year salary increase agreement with the government, has said while the agreement may not be ideal, it is a step in the right direction.
St. Lucia's Dr. Ernest Hilaire prepares for legal battle against opposition member Nancy Charles. DBS St. Lucia has the details.
Castries South MP Dr. Ernest Hilaire has announced his plans to sue the United Workers' Party's mobilization officer Nancy Charles, citing defamation as the basis for his complaint. During a sitting of Parliament held on Tuesday, Dr. Hilaire elaborated on his grievances, asserting that Charles is among a number of individuals he intends to confront legally regarding what he describes as unfounded and misleading allegations concerning his behavior and actions in public office.
It stops with Nancy Charles today. She said last week, I cannot respond, I can't even sue her, but it's not true. But Nancy Charles will get a letter today, tomorrow at the latest, to appear in the courts to prove all the things she said and to give all her evidence.
Passionate speech primarily aimed at the opposition UWP, the Castries South MP made it clear that political attacks would not weaken his resolve.
I don't go to bed dreaming of being Prime Minister. George Charles didn't leave no will to make me no conscience of Labour Party or no right to me. I am just honored to serve my constituency. And when I feel I have done enough, I will move on. Those who harbor those dreams, that's theirs. Those who want to go and enjoy all the, the benefits of power, how we call it, chagoué pouvoir, and those who never really had it but dreaming of it. I am not one of them.
The Member of Parliament for Castries South has faced several corruption allegations, the most recent being related to his oversight of the Citizenship by Investment program. Healy, however, has consistently maintained his innocence regarding these claims and is now determined to vigorously confront anyone who makes such allegations.
I've had to read a document sent by the last government to the U.S. Department of Justice asking them to get permission from Gmail to give them access to all my Gmails, to read my messages and all my emails, Mr. Speaker. I've had to read it. I've had to read, Mr. Speaker. I've had to read Scotland Yard send an email to somebody to interview them because the last government asked that there be a criminal investigation into me. I've had to read it and I've survived it.
Dr. Hilaire has announced a shift in his political approach, vowing to adopt a more combative stance in the upcoming year.
Because the elections is coming in 2026. I can't continue to just try to be best minister and best parliamentary rep. Not anymore, Mr. Speaker. It's time for me to start answering because I can fight.
For the DBS News World, St. Ron Gillis reporting.
We now bring you these international reports.
In Gaza, medical staff say Israeli airstrikes have killed a team of Palestinians guarding aid shipments. They say the 12 workers were among 36 Palestinians killed in strikes on Rafah, and those killed had been protecting the aid trucks from armed theft. Another Israeli strike in Khan Yunis has wounded members of a team doing a similar job. Let's speak to our Middle East correspondent, Yolande Nell, who joins us now from Jerusalem. So, Yolande, tell us more, first of all, about what we know about these strikes and those who were killed.
Well, just to say, at least 36 Palestinians killed across the Gaza Strip, according to what the local media are saying. But particular interest in these groups who were said by local people, including the mourners at their funeral, to be involved in securing aid shipments coming into Gaza. This after we've been hearing in recent weeks from humanitarian workers that in the south of Gaza especially, the biggest obstacle for them getting aid in and distributing it has been the violence of these armed gangs who have been looting the incoming aid. And we know that remnants of Hamas police, along with some civilian volunteers, have been mobilising to try to protect the aid shipments. The Israeli military has now commented saying that the men that it targeted were armed Hamas terrorists, it said. It accused them of trying to loot the aid themselves. And this comes against the backdrop of these severe food shortages that we have been hearing about so much, particularly across the whole of the Gaza Strip. In the southern part of the Gaza Strip, that's where most of the displaced population is now based. Worth mentioning too that this development happened just hours after we had the UN General Assembly voting in favour of an immediate ceasefire and hostage release deal in Gaza, and through the day we've actually had some developments showing that once again there are these international efforts to try to get such a deal going. We've got the US National Security Advisor Jake Sullivan, who's been here meeting the Israeli Prime Minister. He's expected to go on to Qatar and Egypt. They've been regional mediators on a possible deal, which they've been working on it along with the US.
We've also been hearing, Yolande, about a shooting in the occupied West Bank. Tell us more about the situation there.
Yeah, a reminder of how there is, unrest continuing in the West Bank as well. This was a shooting on a bus leaving an Israeli settlement that was heading into Jerusalem, and a 12-year-old boy has been killed. His funeral has been taking place, and we heard that there was a big manhunt going on, particularly in the Bethlehem area last night, with the Israeli army putting up roadblocks. The Palestinian attacker eventually is said to have handed himself in.
Now, new data shows the number of under 50s being diagnosed with bowel cancer is increasing worldwide. Studies are still establishing the main causes of bowel cancer, but it's thought poor diet, ultra-processed food and obesity and lack of exercise may be factors. England is among the countries with the biggest rise, averaging 3.6% increases in cases amongst that age group every year. Dr. Rachel Orrit is from Cancer Research UK. She explained to me why bowel cancer cases seem to be on the rise amongst younger people.
There could be a number of factors at play, things like obesity, which we know the rates are increasing across the UK, but there also could be effects of things like early detection. So in the past, where people were being diagnosed in their 50s, potentially that shift causing the increase in the rates that we're seeing in younger people. There may also be impacts of genetics and genetic changes, but what's clear in all of this is that research is critical to understand this first and foremost, and then to tackle the problem once we better understand it. And that's why Cancer Research UK is funding research into this issue through Team Prospect, which are a global cancer grand challenges team. And they're looking into the causes of bowel cancer in younger adults, but also strategies to prevent it.
We've seen, just looking at the numbers, the steepest rises in early bowel cancer incidents were found in Chile, New Zealand, Puerto Rico, and in England. Tell me a little bit about what kind of an impact colon cancer, bowel cancer diagnosis has on someone.
I mean, bowel cancer is one of the most common types of cancer. But what's important to note here is that it's still not a common disease in younger people. So only around 1 in 20 bowel cancer cases are in younger adults. Now, of course, whatever age you are, a cancer diagnosis is hugely impactful. And that's why research is critical. We need to go further and faster when it comes to bowel cancer.
So what can individuals do if they're worried?
I mean, the main thing, if you're worried about something specific like a symptom, is to know that you can go to your doctor. That's what they're there for. So it could be that you've noticed something specific, potentially a change in bowel habit, or something a bit more general, things like losing weight without trying to, or feeling tired, fatigued for no clear reason. The doctor's there to help you understand that. The chances are that that's not going to be cancer. So it's important to make that clear. But if it is a cancer diagnosis, getting a diagnosis at an early stage is critical, because that means that treatment's more likely to be successful.
You were listening to the WINN FM 98.9 newscast. Our top stories were:
Water engineer anticipates desalination plants will be online in 2025. Recent road tragedies reignite road safety campaign.
Avian influenza H5N1 and its implications for the region. The Royal St. Christopher and Nevis Police Force provide more details on tragic traffic accident that claimed 4 lives in St. Kitts. Police investigating sudden death of 51-year-old St. Johnson's Village resident. HIV and AIDS Secretariat Director reports 237 known cases of HIV in St. Kitts and Nevis, suggests the actual number is higher. Guyana opposition party says 10% salary increase for public servants further widens income gap. St. Lucia's Dr. Ernest Hilaire prepares for legal battle against opposition member Nancy Charles. Internationally, Israeli strikes kill 12 guarding Gaza aid lorries, medics say. Thank you for listening.